All right, so welcome to Influential Dental, where we are inviting some of the most influential doctors, dentists, dental professionals onto our show to hear a little bit about their journey in a very candid way. Today is extremely candid because we are at ADI 2024, the event, and we are live with people all around us. So I'm here with Fuzzy Mike. Sorry.
I heard that story.
Yeah, you were. Anyway, that's a joke, but he doesn't have his fuzzy mic, so I'm going to pass the mic, let him introduce himself. But my co-host, Michael Keeter, is here beside me. I'm Julieanne O'Connor, Influence Coach to High Achieving. Excuse me, gosh. Let me say that one more time. They'll edit this, right?
Right.
Influence Coach for High Achieving Dentists and CEOs. And Michael Keeter, introduce yourself.
Yes, hi. My name is Michael Keeter, and thank you, Julieanne. Introduction. Great to be here at ADI 2024 in Orlando, and looking forward to a great event the next few days. So it is interesting that we're live in the hall with all the other vendors, so we'll have a fun day today with our guest, which Julieanne will introduce. So thank you, Julieanne.
All right, so I feel super lucky, and I was so happy to see you last night that we are joined. I have to share. We are joined by Dr. Brian Evans, who is not only a close friend, but also a colleague, a doctor, and he is amazing. I can't wait for him to share some of his journey about where he has gotten to in his career, but more importantly, a little bit about his personal life and where he's come from, because he's got a lot of story.
Lots of
I'm going to
stories.
turn it to you, and welcome. Thank you for joining.
It's good to be here, and I'll tell you, whenever it gets fall time, football season, there's no golf on, and daylight savings, everything changes. I always look forward to this time of year, mostly because of last year, ADI 2023 was so much fun, such a great event. I got the invite back this year, and I'll tell you, marked it on the calendar, excited, mostly because of the people we get to be with. So I'm just honored to be here. I've got goosebumps talking about it because I love being with you people, and it's just, and I've said it a couple times. I said it last year. I say it all the time, and my poor college student, 18-year-old at college, freshman, really try to be influential with her. I tell her name's Kyrie, and I say, Kyrie, you are literally the average of the 5 people you spend the most time with, period. Choose wisely. And so I'll talk to her. She goes, yeah, Dad, I know 5, average, whatever. No, say it correctly. It's important. Well, that's the same thing, and being associated with you guys and the group that here at ADI, and just professionally, the collaborative group that you guys have put together, and to be a part of that, you're the average of the 5 people, and I appreciate that you guys are part of my group of 5 and within the dental industry and influence and professionalism. So it's an honor to be here.
I have to say, he wants the mic. I'm not going to give it to him. Okay. Stay over there for a second. Okay, simmer down. So, first of all, thank you for that. And this podcast is hosted by American Dental Institute, ADI, who puts on this event. And they're such good people, right?
Yeah.
And so are you. And I just still remember the laughs we had in Las Vegas. And you guys will get to meet Tracy later on, Dr. Tracy, I should say, who is Dr. Brian Evans' wife, and we're going to definitely interview her if she'll let us today.
She'll be so much better of an interview than I am.
Oh, no. Stop. You're fantastic. This is a candid show, as we all know. But I'm curious, really quickly, where did you first hear that whole concept of, you are the average of the 5 people that you spend the most time with?
Good questions. I believe I was 19, 20 years old. I was out in Ann Arbor, Michigan, and I was doing some missionary work. And I ran into, I think, the president of the business school at University of Michigan. And last name Quinn, I think. Anyways, he was meeting with a small group of 19, 20, 21-year-olds who were looking to do something with their life. This is pre-college, don't know what we're doing yet. And I remember he had 2 things he talked about. Being a positive deviant, which to me I was like, I'm a deviant? He's like, no, young man, slow down. A positive deviant, right? Constantly taking a positive path, being that deviant, but in a positive way. Being a leader differently than just, hey, look at me, I'm great. Don't try to draw the attention. Let the attention come naturally based on what you're doing. Let your works speak louder than your words. So the whole idea of being a positive deviant, and then I believe he was the one that taught me the concept, hey, you're the average of the 5 people you spend the most time with. And if you want to be this, You spend your time with them. If you don't, then you won't.
Right, just like our kids, right? Nothing good happens after midnight, right?
Right.
So both of those, I think, go hand in hand. And I got to meet you at that event a couple years ago in Las Vegas, yourself and Tracy, and it was very fun. And just your energy and just your camaraderie just from day one. So you know good people from the get-go. So again, appreciate you being on the show, appreciate you being a friend, appreciate you being that influence in your day-to-day lives in the San Diego area as an oral surgeon, on the stage talking, but just in general, your overall being. So again, thank you. But I agree with you. This show is about not only influence, but also positive force in the dentistry space. As we know, there's a lot of cutthroat things going out in dentistry.
Yeah.
People don't necessarily get along. I don't understand why. There's not only plenty of business for everyone involved, but you do right. Good things happen to you as you are doing good things in the community. So that's what we're all about. So, again, thank you. On those lines, obviously you've done a lot. Can you just share a little bit about your background and where you are today and kind of maybe some forward-looking things for 2025?
Yeah, for sure. I'm going to jump way back.
Sure.
Went to dental school at University of Louisville, out in Kentucky. Louisville, you got to say that correctly, or you get in trouble. Loved it out there. And halfway through my, we're live, so we got a lot of people wandering out. Yeah. Hi, everybody.
We look all crazy.
Yeah.
We're,
I'm also very ADD, so like if there's something, I'm like, squirrel. Yeah, exactly. Anyways, at University of Louisville, I was there studying, and one of my who is a high-risk OBGYN, who kind of was one of my mentors going through undergrad. I didn't really have any doctors in the family, and so I kind of leaned on him. He was the guy that said, hey, if you want to get an A in organic chemistry, you're kind of a knucklehead, Brian. That's 4 hours a day of studying, not just studying for a test. Every day, 4 hours organic chemistry if you want to get a good grade in that class. I'm like, okay, I'll do it. Kind of that type of mentor, right? Well, he was a Navy high-risk Navy high-risk OBGYN. And so as I was in dental school, he's like, hey, have you considered military service? I was like, yeah, I don't know, this and that. And I looked into it. I was like, you know what? What a cool idea. Be able to give back. They pay for education. But then get to spend the first 10 years of my career almost on a field trip, going around the world, treating these types of people, right? War vets, wounded warriors, and then soldiers getting ready to go out or coming back from surgery. So in dental school, I joined the military, United States Navy, and the whole idea of practicing medicine or dentistry or oral surgery in the Navy was different because there was no cost associated with anything. It could be a 19-year-old young man, young woman with facial trauma, and I could offer them the Rolls-Royce treatment. I wasn't limited on them accepting a treatment plan. And same way, my wife Tracy also trained in the Navy as a dentist. And same thing, there was no crowns, there was no certain number of things you had to do. You treated the patient, you treated the tooth, you treated the defect, and that was the basis. So now that I've been out of the Navy for a couple years, I approach it the exact same way. Because the last thing I want is for a patient to feel like, hey, I'm trying to sell you something. Because that's out there. We see it, I hear it all the time when people come to me. And so my whole basis of practice, the way I work in San Diego with our Full Arch Center, or when I'm doing trauma on the kids or whatever I'm doing, is, hey, I'm here to take care of you based on what your needs are. Nothing to do with my surgical capability, nothing to do with what I want, it's what you need.
Okay, so I love what you're saying, and tomorrow I'm going to be speaking about case acceptance, right? And my topic really foundationally starts with, if you want to increase case acceptance, then answer the question, how do you become more human, right? And so it's interesting you're saying that, but then I also hear all of, everybody trying to teach people how to close sales. And how do you do that when we are constrained by the costs? I have 1,000 more questions about your family and your own possible trauma from the military service.
Right.
But let's start there, because that might be really practical information for people who are out there struggling. The costs are real.
Yeah. So we have fixed costs. Everything costs something. I am a firm believer that once a patient is educated, they understand their personal situation and what's available to them, they will make a decision based on where they're most comfortable. Because, I mean, I'll be honest, some of the treatments that we offer and that we do, that's a brand new car. That's a really nice brand new car. Whereas some of them are not. And not everybody is in a position to be able to afford that. And I try to offer everything to the patient, and then based on what they can afford, I'll tailor it. And I get in trouble all the time at my office. Again, this is the Navy coming in. I give away so much treatment. Not full cases, but I'm like, hey, this is what you can afford. If we do this and this, it's going to make exponentially more of a positive influence, or take you from 20% functional ability to 50%. Sure, I'm going to throw a couple of extra implants. I'll do a little bit of extra work because I'm trying to take care of the patient. And I'll tell you, not that I care about closing cases, although we have to because we have to get paid. We close everything because they don't at all feel like it's an exchange of money. It's an exchange of an experience, and it's an investment into their care, into their function. And people will do that all day long if they feel that there's a benefit there.
Yeah. And that's amazing. First and foremost, thank you for your service. So we appreciate all those who
for your
served our
support.
country and do appreciate that. But again, be good, do good. I think it goes a long way with patient acceptance. I've been in the dental field for 18 years in various capacities and have seen it all the time, as Julieanne does now, working with and coaching and her every day or out there in the field. But the thing that I see is if you have those conversations, you sit down, you talk about their needs, their wants. They're not a number, they are a person. Your team at your office also knows that. Again, at the end of the day, it is about the patient. It is about the patient experience. The business will come. I mean, I see it time and time again, but when people put the pressure on them about getting a number, don't do right by their patients, always come back to them in a negative way. Whether that's a case you shouldn't have accepted or should have referred out to say you if someone's trying to do it themselves, or you're doing it for all the wrong reasons. I think more and more dentists and those that are listening to our podcast or watching what we're doing, think about that the next time you are treatment planning a patient, to do it for the right reasons. And again, it'll come back in fold because guess what? They'll tell about their experience to someone else. They'll post a positive review. They'll come back in, and it's the right thing to do. Yeah. So thank you for that as well, because it's so refreshing, because you hear all these horror stories about people doing it for the wrong reasons, and it ends up to be a nightmare for both sides.
Yeah. Well, and I think one of the just life experiences or lessons I've learned the last 4 or 5 years. So just big picture real quick. I have my office in San Diego where I'm partners with Dr. Sharafi and Dr. Zanda Bakili. We're a full art center. We also do full scope oral surgery. I also spend half of my month doing trauma at the Children's Hospital. And that's tough. I don't like looking at kids that are all everything from top to bottom. It's a level 1 kids trauma center. And again, and I'm going to beat you to it, I'm a big brother of a lot of flipping kids, like a lot, right?
Can't believe it.
God, last time I checked, no. I'm the oldest of 18 kids.
18. Like
And-
the parents, I don't even know.
Okay,
They just
so
reward of some sort.
and
like that.
my dad asks all the time. I keep telling my parents, like, can you imagine if you were one and done? Like, if I was the only kid, he always looks at me. He's like, son, which one of your brothers and sisters would you get rid of? And I'm like, Scott, Leslie, Mark. I just go, no, I love them all, and it's a great big family. But I have this big brother instinct, and I'm a dad and the military. And so when I go into the Children's Hospital and I have to look at a parent, I'm like, oh, their kid is all beaten up. And I go in there and I'm like, listen, first and foremost, I'm a dad. Second, I'm a friend. Third, yeah, I'm a surgeon. I'm going to fix your kid. But fourth, your kid's alive. Everything's going to be okay. Everything's going to be okay. And that's just the way I practice, but it's crazy. The kids come to me because they have to at the trauma center. Now I got the parents and the families of these people coming to my oral surgery office. Like, I'm not asking them to come, but they're like, hey, we had this experience. We want to continue with our own care. So it's worked well, just that whole family mentality like you talked about.
So this is just a question because we talk a lot about mental health on the show. It seems to be a recurring topic. Yesterday or the day before, we heard about another colleague who committed suicide, and so we're all talking about why one person chooses one path, another chooses another. And you see this also with people in, in EMS anywhere where they have a higher mental health issue, right? Or a lot more problems dealing with the traumas that they see. So you see it with ambulance drivers and paramedics and firemen and everything else. So you're one of those people who's totally grounded with gratitude. I think it's real. You have known
I
you
hope
long
it is.
enough.
It feels real. Yeah.
But I say that really genuinely because the colleague we were talking about yesterday seemed very happy on this outside. I mean, biggest smiles you'd ever seen. You'd never dream, right? And
Very successful. Like, just everybody looked up to him.
Yeah,
many
you know
reasons.
exactly who. And I had another colleague, same thing, shared stage with me and did the same thing. Never would have known.
Yeah.
So what's different in the way that you approach your service? And is that something you're born with? Is it something we can teach people? Like, what's the secret, if there is one? Can you shed light on that?
Really good question. I can only speak for myself. Man, I've seen a lot of stuff, and a lot of gruesome things, a lot of horrifying things, but a lot of that transition from the trauma to the healing. How do I deal with it? I don't know. For me, I think it's just part of my makeup, or I'm suppressing it and it's going to come out in my later ages. But when I go to bed at night, I don't see the traumas. I see the smiling faces of the parents and the healed kids.
Yeah. Well, and I was thinking about that as well. I think obviously your support structure, right? The people that are around you, those 5 people that you're the average of, right? I think that's key, and that you're not alone. I think so many dentists in the dental profession, they're taking it all on themselves, right? They don't have that team.
Yeah.
They don't have that support structure, whether it's professionally or personally, right? So I think it's so important. Or they need a coach like Julieanne to go there and talk them through that, and to say, hey, you know what, it's okay. You know, we all have good days and bad days and so on. So I think it is something innate, but it is something that can be brought out of anyone, I think, by having the right people around you.
Right.
I think you lead by example. Then again, you seek others out that also lead by example.
Right, and you make a really good point. Those, at least in my circles, those 5 people, I have my professional, my surgical, my influential 5. I have my emotional and my family ties 5. I have multiple sets of 5, if you will. And I'll tell you, the one that is probably my biggest is my wife. Because we share so many things, we worked together on the aircraft carrier for 2 years. We took care of all these people. She's fully aware of all the traumas I take care of. She can't deal with it, and I'm okay with that. But she's right there and she's supportive. And we can talk to each other because she goes through it too with her dental practice and the things. And I think the fact that we can open up and talk and say, hey, my day really sucked. And it's, tell me about it. How can I help? Having that is so helpful because it's a sounding board, right? It's very easy for me to know you or you don't know me and be like, hey, you need a little help, my friend. Like, what can I do?
And I think that's so. I mean, foundationally, you have this trust that you can open up, and you obviously are proactive about it. Sometimes I think that I have the answers on, what people can do, but really where I find that people get the most support is when somebody just listens to them, because it's not pretty. And we all walk around pretending like everything is so perfect, and then we all walk around comparing ourselves to what seems like perfection. And that is rampant with dentistry or doctors, where they hold it all together. They've got this whole team that looks up to them, and then their families too. So oftentimes they don't have somebody like Tracy to speak to candidly. They're hiding it from their wives. You can't believe how many times I've had doctors come up to me and tell me how much debt they were in, and that they have thought about throwing in the towel because they can't face their families.
Right.
They can't tell their wives.
Right.
I mean, it's incredible that people hide it that much, and that is seems somewhat trained into them, that it's like go, 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 and don't stop and think about.
And I think a lot of it is, social media can be so good for so many reasons. It can also be very detrimental to a lot of people. It's putting on this face, this persona, like this lifestyle. And I'll tell you, as a provider, I feel very responsible for the comfort of my family. And I know my wife does too, but I don't know if she feels it the way I do. And almost to the point where I will do anything for their comfort, right? And I think that gets overdone sometimes. And then when there can't be that communication, be like, hey, we're not really as good off as we think we are. We need to scale back, or we need to change some things. Then all of a sudden it's a social image issue. And socially it's not okay. At least it hasn't been, and I think it should be. But it's not okay to fail or have to take a step back or to have to downgrade or downsize. I think that's the most important and healthy thing someone can do is downsize and just keep it simple or keep it simple again.
Right, and it's okay also to reevaluate and, like I said, pivot.
Yeah.
And to pivot for a week, a month, get a hobby, exercise, change something. But at the end of the day, it's about communication. Need help, to seek help.
Yeah.
And that's it. And I think, as you spoke about, it's okay to fail. It's okay to succeed. It's okay to be human.
Yeah.
And to be vulnerable, right? But at the end of the day, I think that's what also makes you and others successful, is you can be that same way with your patients, right? And I think if you're with that with your patients, you're with your team, you're with that at home, then it all works itself out.
Yeah.
To just hijack the mic because I have already been given the indicator that I need to go in and get on stage and introduce our next speaker. So we have to wrap this up, but I would love to have you back on the show.
Yeah,
I would love to do. We'll do it when it's not here in front of everybody under the sun. But you're amazing. I'm so grateful for you being here. If you could leave listeners and viewers today with one just piece of advice, whatever comes to mind, the first thing off the cuff.
I think Mike just hit the nail on the head. Be a good listener. Listen. You're not going to understand a patient, a spouse, a former or a colleague, another professional, until you listen. So often we want to fix everything, and sometimes people that come to us with issues just want to be listened to. They don't want it fixed. And I hope we have an adult audience, but my wife taught me an important lesson because I try to fix everything. Stop and listen. You're not wrong. You're just an asshole. And what she means by that is, I don't want you to fix my problems. I have tools to fix them too. I need you to listen and connect with the emotional side of what's going on. Then we can work forward together. Same thing with patients. They don't have teeth. Yeah, they don't. No, they know they don't have teeth. They want to be felt, understood, and listened to.
I agree with that fully, and my husband, he has the ability to repeat what I said when I say, hey, are you listening? And I'm like, I always just try to reiterate, it's not about whether or not you can repeat me, it's whether or not I feel heard. That's all 100%. I care about. So with that, I think we need to wrap this up. Thank you guys both for being here, and Mike, you're an awesome co-host. I love doing this with you. Thank you.
Thank you. Love Brian you guys. Evans. This is awesome.
Is there any place that if somebody wanted to reach you, they could reach out to you?
Reach out to you, and you have all my contact.
There it is.
100%. Phone calls, text, anything.
Okay, perfect. So you guys can reach us at AmericanDentalInstitute.com. My social media is at Spelling It, just like it sounds. And someday you're going to share your social media too. But with that, I think we need to call it for this show. And thank you so much for tuning in, listening. Anything else?
No, thank you, Dr. Evans, and always a pleasure, and look forward to more conversations. And thank you, Julieanne, as well. So have a great day, everyone.